Welcome back to the KOAM Morning News. And on this Medday Thursday, as the summer months roll around, we find ourselves in the midst of July. I know a lot of people are trying to get out, especially compared to last year, and get some fresh air and some exercise. However, some people may find themselves with some health issues that makes it very uncomfortable and actually can make it unhealthy to get fresh air. And that's why we're kind enough to be joined this morning by Jennifer Meister. Jennifer's a registered nurse at Mercy Joplin, and this morning specifically, we're going to talk about bariatrics and weight loss surgery. Jennifer, number one, thank you so much for your time. I greatly appreciate you bringing this education to our audience. People may think, well, if you have an issue with your weight, why don't you get out? Why don't you pound the pavement and walk? And why don't you try X, Y, and Z? But you know as well as I know, that is not the case for some people when it comes to bariatrics. Can you explain why that may be a common misconception?
Well, with bariatrics, the patients that see us are often patients that have tried all of those things. They've tried the different weight loss diets out there. They've tried activity, and it just isn't working for them. And then they come to us to help get a tool that will help them be successful, give them the extra edge in the fight against obesity.
And I love the fact that you brought that up. This is not one-stop shopping. This is the fact that people have exhausted other options. They're being responsible, and they're trying to keep themselves in check health-wise. When it comes to bariatric patients and everything, they have what the healthcare profession likes to call comorbidities. It's a big word, folks. I understand that. It means that one health risk can cause additional health risks along the line. What are some of those common ones that you see in patients that you serve at Mercy Joplin?
Well, some of the common comorbidities that you would see in a patient with obesity would be hypertension or high blood pressure, sleep apnea, where you stop sleeping or you stop breathing when you sleep at night, and type 2 diabetes are some of those comorbidities that you may see.
And so when it comes to weight loss surgery, this is a chance to kind of keep those extending health factors under control, because like you said, and I want to hammer this point home, folks, Jennifer said, you've exhausted other options. You really have tried. And people may be amazed to know that weight loss surgery is an option, but surgery always sounds scary. That's always a scary word for people. What's your elevator speech as far as describing to somebody that you may identify who could benefit from this? How do you alleviate some of those fears?
Well, I alleviate some of those fears by talking to them. You talk to them about what they have and they haven't done in the past. And by the time that they come to see us, they're very exhausted with what they have been doing to lose weight, to help improve their health. And when they're here, they're ready for that extra step. And we let them know that by having the surgery, it will help improve some of those comorbidities and improve their quality of life. They'll be able to move easier. They'll be able to breathe easier. They'll be able to take medications for some of those comorbidities. So highlighting the benefits of the things that they will gain after having the loss of weight.
Well, Jennifer, I love the fact that you just brought up the possible options going forward as a patient. On this Medday Thursday, I know you are super swamped, taking care of patients and whatnot. Is there any way I could talk you back into coming in and just visiting with us here in the next hour or so, just so we can kind of break down what those options may be?
Yes, that would be great.
Thank you. I appreciate that. And we'll catch back up with Jennifer Meister here in just a little bit on this Medday Thursday. More KOAM Morning News for you right after this.